this lesson, we are going to be talking about the diagnosis of measles or rubeola. So I just want to make a really quick note here. There is another disease that's called rubella or German measles. So as you can imagine, these two diagnoses aren't that different. They're both called measles, but rubella, which is the German measles, is less severe and causes less problems in kids than rubeola, which is what we are going to be talking about. I do want to point out, though, that rubella is very, very dangerous for both pregnant mothers and for fetuses. It can cause birth defects and miscarriages, and so that's a really important thing to know about rubella, which is not the one that we're talking about today. So I just wanted to make that distinction and highlight that quick learning point. But from this point forward, we are going to be talking about rubeola, or just plain measles. Okay, so rubeola is an extremely, extremely contagious viral infection that actually can cause a lot of negative long-term side effects. And guys, I just want to point out really quickly, I didn't even realize this until I did a bit of extra reading on this a couple weeks ago, but rubeola is so contagious that if you aren't immunized against it and you come into contact with someone who has it, there's a 90% chance that you're going to become infected. So that's what I mean when I say very, very contagious. And when it's spread via contact with droplets, and this can also become infected. You can also become infected when it becomes airborne or as it's aerosolized when patients sneeze and cough and things like that. Rubeola actually was really rare in the United States, but it's actually on the rise right now. And in fact, there's an outbreak going on right now in 2019. That's the worst that's been seen in the US since 1994. Now, the reason for this rise is it's pretty complex, of course. It's a combination of things. So it's an increasing globalism as well as some under-vaccination that's happening. Now, everybody knows that there's been a ton of controversy around the safety of the MMR vaccine, and that immunizes kids against measles, mumps, and rubella. But a study done in 1998, and this is where the controversies come from, reported a link between the MMR vaccine and autism. And this really caused a decline in the number of immunizations that were happening. Now, I just want to highlight that this study has been completely discredited since then. It's even been found to be unethical. And I talk a little bit more about this in the autism spectrum disorder lesson. So definitely go check that out if you want some more information on it. So because it's so contagious and also has so many long-term side effects, it's really, really important that we educate caregivers on the safety of this MMR vaccine, because this is going to be what helps us stop those outbreaks and protect those in the community that are the most vulnerable. For our peds patients, the most vulnerable are going to be our infants, so less than a year, and then any kids who have a compromised immune system or compromised respiratory system. If we do get our caregivers to consent to the MMR, which is the goal, the vaccines are going to be given between 12 and 15 months, and then another dose is given between 4 and 6 years. Okay, so for your nursing assessment of a kid who has measles, there are some pretty classic symptoms that you need to be familiar with. The first thing is that measles usually cause a pretty high temperature. So we're talking greater than 40 degrees Celsius or 104 degrees Fahrenheit. And then you have all those great symptoms that come along with fever, so malaise and just feeling really awful, and then loss of appetite as well. The next classic thing to be aware of are the 3 C's, and the 3 C's are coryza, cough, and conjunctivitis. Now, coryza is just a fancy word for inflammation of the mucous membranes in the nose. The next symptom is going to be Koplik spots, and Koplik spots appear on the inside of the cheek. And these are really small gray-white dots that you can actually see here in the photo. Koplik spots are only associated with the diagnosis of measles. So if you see these on a patient, you know exactly what the diagnosis is. And the last classic symptom is the rash. And the rash is actually pretty extensive, meaning it's going to be covering a large portion of the body. And this rash is made up of small, flat, or raised reddish-brown spots. And you can see a really great photo of it here. The flat spots are called macules, and the raised ones are called papules. And so when they occur together, you get what people call a maculopapular rash. In measles, these spots become so numerous that they actually join together, making patches. And again, you can see that on the photo here. And the presentation of this rash is actually going to spread from head to toe. For your therapeutic management, the very first thing you want to do if you suspect that a child has measles is make sure you place them on airborne precautions. And also, this takes a little bit of extra effort on our part because it does require that a special mask called the N95, which you see here in the photo, is used. And we have to make sure that the staff that are taking care of the kids have been properly fitted for this type of mask. And then also really important with most of these infections that we're talking about in this module, but make sure that no pregnant staff members are assigned to take care of this patient. And for our medical care, really for the most part, what we're going to be doing is providing supportive care. So we're encouraging rest, monitoring hydration status, and giving fluids as needed. We can provide eye care for the conjunctivitis, and a cool mist vapor spray actually may help with the cough. Some medications to be aware of are obviously going to be antipyretics like acetaminophen and ibuprofen. And remember, no aspirin for kids because it can cause Rye syndrome. And in cases where a kid has to be hospitalized or has a really severe case, vitamin A may actually be given because studies have shown that it drastically improves outcomes and it also helps prevent eye damage. Now, this topic of eye damage brings me to talking about complications. So it's really important that we are monitoring for complications. A lot of cases of measles are going to be handled outpatient and not have any problems. But complications can happen and they are often devastating. In the short term, patients can end up having pneumonia and encephalitis, which is life-threatening. And then in the long term, kids can actually end up with blindness, hearing loss, and learning difficulties. So it's really important that monitoring for these complications are part of our nursing care plan. Your priority nursing concepts for a pediatric patient who has measles are immunity, infection control, and health promotion. Okay, let's go over your key points for this lesson on measles. First thing to know is that measles is an extremely contagious viral infection. And I think I actually forgot to say this earlier, but people are actually contagious until 5 days after the rash appeared. Measles is spread through droplets and aerosolized secretions, so always make sure that airborne precautions are in place as soon as you suspect the measles. For your assessment, the major things you want to keep in mind are a high fever, the 3 C's, Koplik spots on the inside of the cheek, and then that rash that we talked about. Our treatment is pretty much focused on being supportive, and then in severe cases, vitamin A can be given to improve outcomes and prevent damage to the eyes. And remember, a major part is health promotion and prevention. So we want to be educating about the importance of the immunizations because remember, measles can totally be prevented with the MMR vaccine. Complications are a huge deal with measles, so we want to make sure that we know about pneumonia and encephalitis because they are the most common causes of death for kids with measles. And then think about those long-term issues like hearing loss and blindness. All right, you guys, that wraps it up for our lesson on measles. Make sure you check out all of the great resources that we have attached to this lesson. And as always, I want you to go out and be your very best self today, and happy nursing.